Well, a big disappointment to mental health care in the Twin Cities. North Memorial Health announced it plans to cut more than 100 jobs, including closing their outpatient mental health program in Robbinsdale. And that second part is part of a larger trend we've covered over and over on this show, where those who need help the most quickly are running out of options. Gordon talked to mental health leaders about the funding issue they say is behind all of this and the impact this could have for all of us.
Yeah, according to North Memorial Health, these cuts will affect about 3,400 mental health patients. They say they're working with other health systems and clinics to connect their patients with care somewhere else. But mental health leaders say there aren't enough options, care options, to go around.
What kind of an impact could we see from this?
We've had smaller places closed, residential facilities, day treatment programs for children, but this is a fairly large clinic, part of a larger health system, and they're closing.
Sue Abderholden with NAMI Minnesota isn't surprised to hear a large mental health program is closing its doors, but she is concerned.
Going into this, I understand there was already a shortage of services.
People are already waiting months even to access therapy, and then even longer for psychiatry.
Abderholden says she's less worried about the employees who lost their job because a lot of clinics and hospitals are hiring mental health workers. She's more worried about the patients.
I think some people are going to be devastated by this, to say, well, what happens next? You know, if you are already living with anxiety, right, and now you know that your clinic's going to close in August, which gives you some time, that's true, but that's just going to increase your anxiety.
She's also worried about the underlying issues behind this closure. North Memorial Health says they struggled financially to provide mental health services due to a growing number of patients covered by government-sponsored health plans.
Medicaid is the largest payer of mental health treatment. The largest payer, not private insurance. And we all know that Medicaid pays a whole lot less. And so their kind of operating margins, if you will, are usually like zero or next to none. And so when you're operating on that kind of thin margin, it's difficult sometimes to keep places open.
The Minnesota Hospital Association agrees. In a recent statement, the association says because of public programs, Minnesota hospitals provided more than $2 billion in unpaid care last year. Nearly a third of that, about $800 million, they say was due to state-sponsored Medicaid programs.
We've talked to lots of mental health providers who are like, we can't keep going with these low rates. A lot of clinics are struggling to, keep their doors open, to recruit and pay people who are willing to work in clinics that have larger Medicaid populations.
Because they make less money from Medicaid patients, Abderholden says more clinics are deciding to not accept new Medicaid patients. Some aren't accepting them at all.
Clinics are certainly within their right to say we can't accept any more Medicaid patients. Now, that's not something that we want to see, right? Because we want to make sure people can access care, but that is a concern.
Now, Abderholden says there is legislation that is floating around the state capitol to address this issue to boost those Medicaid payment rates. She says it's not likely the rates will go up to the level that they're hoping for, but she is hopeful that they will see at least a minor increase by the end of the year.
Yeah, and this is the unfortunate example that can be shown, right? Like we hear every time something bad happens, it's mental health this, it's mental health that. But if we're not funding people who need it, it's not going to work.
Yeah, I think a lot of people out there understand that we need more mental health services. A lot of people are struggling. She mentioned after the pandemic, a lot more people were struggling with anxiety and depression. But for a lot of these people, they just don't have the options out there in the community.